Hello everyone. I hope you all are doing good. Most are facing the problem to increasing cost of medical care by rational deliberations. The priorities are being assigned. The priorities at one point are very important, but at the same time, at the same point, uh, it is difficult to ignore the increasing costs of medical care, the cost of medicines, the cost of medical structures, the cost of different medical equipments are increasing with the passage of time, and it is making it and it's getting difficult with every passing day for the government to cope with the changing situation with this regarding the prioritizing the medical health. So increased assessment in public health research in order to be able to introduce appropriate and effective preventive strategies. So uh, what should we do? What can be done? What uh, ought to be done by the government? This can be the basic question. This can be the basic. This can be the key question here. That if the cost of medical health, if the cost of medical care is increasing day by day, so what should we do? What can we do to prioritize or to make medical services available for everyone? So addressing this question, uh, the most important point is that the government of any nation state, the government of any country should invest in preventive strategies. Again, I will engage your attention here with the recent crisis in which we are struggling, in which we are trying to cope, that the preventive strategies are being made, that we should prevent it rather to cure it, because we are trying to find the effective cure of that present crisis. But what we can do, we can make different preventive strategies. We can make ourselves safe, and we can make different other people, the community, safe by utilizing preventive strategies, by doing, by the government giving, the government started the quarantine program, that we should quarantine ourselves, we should prevent ourselves from giving uh, the infection to other people. So in this regard, we will prevent the issue, we can prevent it if needs be. So it is very important rather to check on the preventive side of any disease, any health issue, to gain the control over it. So we can make policies, we can make strategies for prevention. This is how we can prioritize our health. This is how we can give uh, health indiscriminate to the public of any country, to the public of any society. Moving forward, health policy in developing countries. So we have three different aspects, but the central issue is the making the best use of limited resources in environments in which there is a wide gap between needs and resources. It means that we have a central issue. It means that we need to address the central issue. After, after addressing that, we will address diversity, complexity, and change. So the central issue is to operate under minimum resources, under limited resources. The central issue is to make best use of those resources for the expectations and performance. So there are three main issues which we discuss, which we will address while analyzing the health policy in developing countries, the countries which are uh, still yet to be developed, yet to gain the status of developed countries. So we have three issues. We have three main issues by which we can analyze, by which we can draw analysis of a health policy for any country, and we can devise a possible solution. We can devise a possible outcome from these three issues. So what diversity means? Diversity means that what is different. Ecological and geographical factors account for some of the variation in the pattern of distribution of health and disease, but economic, social, and cultural determinants also contribute to the diversity. The society is made up of diverse populations. The society is made up of different minds, different school of thoughts. The geography is created different determinants for different parts of the world, and like those differences, like those distribution, those variations, the disease and the health situation is different. So there is diversity in population, and there is diversity in health and disease also, which enables economic, social, and cultural determinants more important for the health cares, for the health givers. The next is complexity. The explosion of new knowledge and innovative health technologies made it is very complex for healthcare providers. It is necessary to mobilize intersectorial action because of the important influence of non-medical factors on health, such as agriculture, education, waterworks and sanitation, labor and industry. Change is transition. Change is what we are uh, experiencing. Change is what we are dealing with. From traditional health problems to this new health problems, from childhood to the adolescence, and from adolescence to the adulthood, such as childhood diseases and communicable diseases are declining, whilst chronic diseases such as cancers, cardiovascular diseases, diabetes, and become more increasingly prominent in the society. It means that we are epidemiological transition in this phase, from which we are moving from one point to another. So this is change and transition. Then epidemics and other emergencies. Epidemics and other acute problems, for example, natural disasters, for example, the current situation in which we are dealing ourselves, the COVID situation, in which we deal with the emergencies and in which we try to mitigate the concerns of effectees, of the victims. So in this regard, we, the government, the people, and the care providers should have this point in its mind. At this regard, they should remember the problems that the natural disaster may arise. So, socio-economic variables are also very important in this regard, like what society is made up of and how society is turning with the passage of health sector, with the passage of development in the health sector. So health policies have had to be modified in the light of rapid development in some countries. The policies should change from one community to another community, but that change should be rapid. Because in recent decades, the national policies are increasingly favoring free market economy in place of welfare programs and central control. So for that we need a better health services, and so socio-economic variables are playing its role in this regard. So primary healthcare function. It means that we should immunization, education on prevailing health condition, food supply and proper nutrition, safe water and basic sanitation, including family planning, treatment of common diseases and injuries, prevention and control of locally endemic diseases. So we should take care, we should give some policies, the government should give a handout, a note, a awareness campaign, a sort of workshop by which the awareness, by which the education, by which the issue can be addressed in front of society, that what type of problem they are facing, that what type of problem they are to uh, face, they are likely to face in near future, and how to control and how to prevent that issue, because prevention is much more cheaper than the cure itself. So if you prevent something, if you can prevent something from something very dangerous or something very huge, with a very huge impact, so we should do this. We should the government should apply this. The government should, a country, a agency, or any health provider institute should give this opportunity to the people to prevent rather than to cure. Then the application of public health sciences and policy, that policies developed in response to immediate health problems, that we should uh, develop from existing knowledge, we should make our development from existing knowledge, and we should apply that knowledge to the specific diseases derived from national scientific research. We should apply that research as well. Then to achieve, what was the goal? The goal is to achieve the training for public health professionals, preferably in national schools of public health as well as abroad. So the conclusion is, not only but must policymakers be knowledge based, it must also be result oriented. careful planning and skilled management can achieve good results. Policymakers must give high priority to strategies that will eliminate the major items of unfinished agendas that will plague many developing countries. So, this is it for today. But in the last, I want to remind you that in this session, we discussed health policy as a model. We discussed health policy to analyze, to know how to analyze different aspects of different policies, and we take health policy as a as an example. You can say that if we try to remember the steps we discussed, you if you will remember the steps we discussed in this session, it will be very easy for you to analyze, to decipher, to dissect any policy given to you. So in the end, I would like to raise some questions which you will address, which you will ask from yourself after listening to this, that why we need health policy, why health is so important, why a government should invest in health policies, why public health is important, why we are discussing public health when we are discussing health policies, what are the role and responsibilities of healthcare providers, what are the responsibilities of the citizens. So these are the basic questions which we have covered in our presentation in this session. So I will encourage you to ask question if you have any in your mind. So please feel free to ask me on my WhatsApp, or you can call me anytime from your class time. So goodbye and best of luck. Thank you so much.